My name is Lance McCall. I am a CVID patient, and I have done all of the forms of IVIG and SCIG, or subcutaneous IVIG therapy. I have been on over 12 different drugs. I was unofficially diagnosed 19 years ago at birth with an immune issue. Back then, you could not be formally diagnosed officially until the age of 2, which was in 2002. And that is when, on paper, it was written that I had CVID. We figured out at birth that I had CVID due to the fact that at my first hospitalization was 6 weeks. I went in for asthma and allergy issues. From then, I was released and stayed constantly sick, close to death's door, due to a lack of immune system and no IVIG therapy being allowed at my age yet. I became allergic to all and every formula and food that my mom ate or that I was given. Even some formulas that were $8, $9 an ounce, I was allergic to those. So by the age of 1, I was already eating table food, which was mostly just boiled rice and boiled chicken. And so in 2000, I was born in 99. So in 2001, 2002, somewhere around that time frame, was when they really did the more testing that they could and decided that I did have, in fact, an immune disease, and then it was CVID. It is a rough road and a long life to live, but it is a life that is doable. It is a life that I always say, do not let this stop you. You can live a normal life, and don't let it stop you. Right now, there's 2 different types of therapy. There's IVIG, which is, of course, IVIG, which is done through a IV line in your arm or leg or somewhere, and it is about an 8-hour infusion. You typically will have like Benadryl and Tylenol and a drug called CVID given beforehand, in addition to saline before and after it. You are hooked up to this IV for about 8 hours, and during those 8 hours, you can pretty much do anything you want, as long as anything you want within limitation, because you are either at home or you are in a hospital or infusion center doing it. I did that for many years, and I actually lost most of my vein accesses to it. So I have a medical report, but I decided to then go to the second form of treatment, which is SCIG, or subcutaneous IVIG, which, unlike the IVIG, it is done every week. It can be done every day, every week, every 2 weeks, or once a month. You do it at home by yourself. You don't have to have a nurse like you do with IVIG. It is a lot less. It's a very quick infusion, a lot less painful. You may see some redness, itchiness, but you don't have all of the side effects that come with the IVIG. You just kind of stay stable. Being your own advocate is probably one of the most important things you could ever do for yourself. Like I said, this is a very unknown disease. A lot of people won't believe you. They won't get it. And say some things. Maybe you're in a wheelchair for some times, but you can walk for others. But just be your own advocate. Make sure that you do what you have to do to make sure that you get what you need to get and able to maintain the life you want. Having a healthy lifestyle is very important because you don't have the antibodies for a lot of things. That's what's in the IVIG or SCIG medicines, is some of the antibodies that your body does not produce. Eating healthy is really helpful because it helps the IVIG and SCIG get absorbed into your body better and work better and provides you with better energy than if you eat like carbs or sugar or junk food, because then that kind of contradicts with each other. So you need to live a very healthy lifestyle. Now, you have to treat yourself a little bit, but you need to live a healthier lifestyle. Just live your life the way you want it and work your infusions and medicines around it. I am Lance McCall from Tampa, Florida, and I am 18 years old.